Tonight, a senior TSA official in Kansas, now turned whistleblower, says the TSA has so far failed to protect its officers or the traveling public from COVID-19, saying there's no standard nationwide for TSA personnel to wear personal protective equipment.
You can't wait 4 months into a national health crisis and decide we're going to start taking certain measures. And even the measures they have in place right now certainly are not enough.
While optional at first, the TSA only began requiring officers to wear face masks the first week of May. Eye protection remains optional, and plexiglass shields are just now going in at TSA checkpoints. Officers must also wear gloves while checking IDs, conducting pat-downs or bag checks. The agency says they are to change their gloves after each pat-down. Travelers may request new gloves to be used at any time during the screening process, but no national standard for changing or cleaning gloves.
They don't have any instructions for what to do when they see somebody who's sick. We're still flying blind.
It's up to the airlines to determine if a passenger is sick. Of 45,000 frontline officers, the TSA reports 706 employees have tested positive for COVID. 6, including a contract screener, have died. Now, the Office of Special Counsel has ordered Homeland Security to conduct an internal investigation, noting OSC has found a substantial likelihood of wrongdoing based on the information submitted. Do you feel TSA officers' health is at risk?
Oh, absolutely. We have employees that are afraid to come to work in TSA. We have employees who are in a higher risk category that have been off.
Frontline security officers on the front lines of a pandemic. Tom Costello, NBC News, Washington.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.